Good afternoon everybody and welcome to Clinic M. And sitting in front of me on our wonderful bit of kit, the Emsella chair, is Tracy Sturgeon, who is a local consultant gynaecologist and a specialist in post-reproductive medicine. And she's going to tell us a little bit about what she's been up to with the chair and her patients. And hopefully you'll find that interesting. And if any of you have any questions following watching the video, please don't hesitate to get in touch and ask those questions. Anyway, Tracy, what have you been up to?
Well, we've been very lucky to have the opportunity to use this fantastic piece of kit. It's particularly useful for ladies who suffer with stress incontinence, or for ladies who have recently had a baby, or women who have difficulty identifying where their pelvic floor is, and therefore maybe have difficulty doing pelvic floor exercises themselves.
Tracy, can I interrupt you? You and I hope, know what stress and urge incontinence actually is, but there may be some of our patients are not quite sure of the distinction between the two. Could you just tell us a little bit about that?
Yeah, so quite often ladies will have a mixture of both actually. So it's really important to get to the bottom of the type of incontinence that the person has got. And I say person because it can apply to men as well, but stress incontinence is where you have leakage of urine as a result of exercise. So quite commonly, going up and down stairs, even standing from sitting, for example. Very commonly people describe it when they laugh or they sneeze or they cough, they leak urine, and that's stress incontinence. Urge incontinence is where there's a real urge to get to the toilet, and people quite often leak urine because they can't get to the toilet in time. They have this very pressing sensation that they have to go to the toilet right away. And some people have an element of both, so it's important to keep in mind that if you're trying to address stress incontinence, that the chair will actually give a really good result for stress incontinence. If there's an underlying element of urge incontinence too, we can treat that with medication. Incontinence isn't something that you have to live with.
I have to say, it beggars belief to me that they advertise nappies for ladies on the TV. I think if men had a real problem, it wouldn't be like that, would it? I mean, it's such a shame that people aren't aware of what we can actually do to help.
Yeah, I find those adverts actually really unhelpful, and they get really under my skin because they imply that incontinence is a normal part of ageing. It's more common as we age, but it's not a normal part of ageing, and it's something that can be treated, and it can be treated successfully actually using this chair.
I'll come on to that in a minute, because I want to ask you a little bit about what results you're getting, because I know you're monitoring your results. But I've also heard that young women in particular can suffer from a type of stress-related incontinence to do with the increasing trend for gym-based activities. Is that correct?
Yes, I'm seeing a lot more young ladies. So exercising without good technique or proper form, particularly weight-based training, is really important to protect your pelvic floor. Many women, and actually trans men who are still biologically female, don't appreciate the risk to their pelvic floor of training with weights and not protecting their pelvic floor. The other younger age group that we see are the older maternity ladies who are having babies into their 40s, because that wear and tear on the pelvic floor is already there, and unfortunately they end up suffering more with pelvic floor problems after their deliveries as well. So we're seeing a lot of younger ladies these days than certainly I used to see when I was first training, with the types of problems that we more commonly associate with an older age problem. So incontinence is not an old age problem, I would say. It's not something to be stigmatised, it's something that can be discussed openly and fixed.
For a wide range of different people, both men and women.
Absolutely.
So Tracy, we have been monitoring results in the clinic, and I know you've been keeping a good eye on that. So how are we doing?
Off the top of my head, I can't give you the numbers, but certainly from looking at the data that we have so far, because we've kept a track of all the patients who've used the chair since we got it. We've got really good improvements in continence for people who've pure stress incontinence. Those are the patients who are seeing the best outcomes. So their scores, and I use a modified ICIQ score to calculate.
Could you just tell us what that, because that don't mean much to me, so it won't mean much to the people watching the video. So what's a whatever it was Q score?
That's the International Continence Quantification Score. So that tells us how bad your incontinence is, and it helps us to classify what type of incontinence you've got, because that then helps us direct us to the proper management of your incontinence. And it means that if we calculate the before and after results, we can determine the degree of improvement that you've had in your symptoms from using the chair. And certainly people with purely stress incontinence are having a fantastic outcome with really good improvement. Women with mixed incontinence are having improvement too, but not quite to the same degree. And what we've realised now is that you know, those ladies, we can be seeing them and treat them with medication for the urgency aspect of their incontinence. So we can come at it from two different approaches and hopefully achieve an even better outcome for these ladies as well.
Thank you, Tracy. Now, if we were to recommend this treatment for somebody, and we would do that, I think, for the vast majority of ladies with some degree of incontinence. We're not trying to single people out. What's the practical way in which we can help people to get help from the chair? How do we go about from a practical point of view, how does someone actually use the chair?
Well, the good thing is that literally all you have to do is sit on it the way I am at the moment.
As simple as that?
Turn it on. Yeah.
I must say, I've done it myself, and it's rather a nice feeling, actually. And there are some side benefits, I think, to treating the pelvic floor, not just with incontinence. I mean, I know for a fact that as a man of a certain age, I certainly found when I used it previously that it helped with reducing the number of times I had to get up at night to go to the loo. And I believe it makes life a little bit more interesting in other ways.
It does, because the pelvic tone is better. Usually there's a fairly significant improvement in sexual arousal and outcomes, so it has a knock-on effect on your sex life as well.
Tracy, thanks for your time. We look forward to talking to you again soon.
Thank you.